For today's case study, I want to talk about the food sensitivity testing. The patient in this case is a 28-year-old female who came to us because she had significant eczema on her hands. She's tried every medication that has been recommended to her over the years and has not found any benefit that lasted with any pharmaceutical or over-the-counter products. She abandoned her studies as a pianist as a teenager because the cracking in her hands made it so painful and she was constantly bleeding, which has caused her significant distress. So she's come to us to find out more about foods or things that may help her with improving her hands. So the first thing we did was recommend a food sensitivity test or an IgG antibody test. On physical exam, we noticed that she had a lot of dry, cracked skin on her hands, which is what she had said she was here for. We also found a very thickened skin on the flexor surface of her arm, that along her forearms there was what we call excoriated lesions, where the scratching had irritated some hives or some bumps on the skin. That the rest of the physical examination, other than her stomach, was very normal. What we mean by that is we checked the scalp, eyes, ears, nose, and throat, and found all that to be fine. Her lower neck was slightly boggy, which might indicate a potential thyroid issue. But when we felt her abdomen, the lower right and lower left quadrants were very irritated. They were very rigid and guarded. She was very sensitive to a light touch, and on a deeper touch, we found there to be no bumps or masses. So the initial treatment plan from day one on her first visit was to do a food sensitivity test or a blood test for the IgG type antibodies to foods. In her case, we also added on an evaluation for IgG antibodies to Candida, which is a yeast which can, in some individuals, thrive in the digestive tract. I made some recommendations. Firstly, that she should take a high-quality probiotic, B vitamins, a high-quality fish oil, omega-3 product, and to take a digestive enzyme with her meals. At that point, although we had done the foods test, I did suggest that she should avoid all dairy, wheat, and eggs as a trial dietary program, and that we would see her in approximately 3 weeks and review the test results. After 3 weeks' time, the test results had come back, and we met with the patient to review these results. She reported that the pain and the cracking of the skin in her hands had improved quite noticeably, although it wasn't entirely resolved, but she was very happy that the hands were in fact healing, which is something that happened to her very occasionally. There were no open wounds from scratching, and so that was also a very good sign. When we reviewed the food sensitivity test, we found that she was showing to have antibodies to all the dairy products, so the whey proteins as well as the casein proteins, that she had very elevated antibodies to the gliadin or gluten protein in wheat, as well as an elevation to wheat and spelt and rye, and that she had an egg sensitivity, and that her antibodies to Candida albicans were highly elevated. So our treatment plan remained to be dairy-free and gluten-free. We also added herbal antifungal products to her treatment regimen in a cycled manner the yeast can be very adaptive to any of the antimicrobial herbs. So we always do at least 2 phases, using 2 to 3 weeks of one product and 2 to 3 weeks of a second product to work on eradicating the yeasts. We continue to take the probiotics, digestive enzymes, omega-3 fish oils, and the B vitamins on a regular basis. We followed up with the patient regularly for the first half a year, and she noticed steady improvements to the point where there were no open lesions on her hands. The skin was healing and it was thickening to a normal level. The skin on her hands had been so irritated for so many years that in fact it was very, very paper thin, somewhat translucent, and it was thickening to a normal level. Her fingerprints were reappearing on her fingertips, which were constantly raw in the past, and we're very happy with that. She reports that she's got no more digestive complaints, and that the skin on her arms as well and in the flexor surface has improved. So we wanted her to visit with her over time, and what we have are some photos of what she was initially and what she was like initially after seeing a good resolution. And then over time, when she might have a relapse in her food choices or consciously know that she was going to have some exposure to one of her reactive foods, that we have this photo of how her hand changed within days after getting one exposure to a pizza. And so she now knows that if she does re-expose to these foods, that she'll continue to have a problem. And so she avoids them faithfully, taking her enzymes, the occasional probiotics, and her omega-3 fatty acids. And she continues to do very well for these several years since we started working with her on this.